in mortality and estimates of excess mortality. And thus no less than Realtas and Minister Hildegard Nocton, you've fit no made. I'm very glad.
I welcome the opportunity to discuss trends in mortality and estimates of excess mortality here today. The Department of Health actively monitors and reviews all available data on mortality, including excess mortality, as it becomes available to gain a better insight on underlying mortality trends in Ireland and factors influencing these. While the Department does not produce estimates of excess mortality, it works closely with the Health Protection Surveillance Centre, the Central Statistics Office and other stakeholders to monitor estimates of excess mortality. A number of different methodologies have been developed by organisations and academics internationally to try to estimate levels of excess mortality. It's important to note that estimation methods vary depending on a number of factors, including differences in methodology and the data used. There is therefore no international agreed method on the estimation of excess mortality. Official data on mortality in Ireland is collected by the CSO based on deaths registered with the General Register Office, the GRO. The latest final data on deaths from the CSO office is for the deaths occurring in 2020. Provisional data based on date of registration of the death is currently available for 2021 and 2022. It's important to note that in Ireland currently a legal period of 3 months is allowed for the registration of a death. An analysis by the General Register Office has found that on average approximately 82% of deaths are registered within this 3-month time frame. Therefore, data for the most recent period is provisional and caution is required in interpreting this data. Ireland's age standardised all-cause death rate declined steadily from 1,152 deaths per 100,000 in 2007 to 923 per 100,000 in 2019. In 2022, the provisional age standardised all-cause death rate was 937 per 100,000. While this was an increase from 2021, it was below the age standardised all-cause death rate of years prior to 2018. As most causes of death vary significantly with people's age and sex, the use of standardised death rates improves comparability over time and between countries. A key factor potentially influencing mortality trends is demographic change and the changing age structure. Ireland's total population increased by 8.1% between census 2016 and 2022. There was a fall in population in some younger age groups, such as children under 4 years. In contrast, the number of persons in Ireland aged 65 years and over increased by 22% more than double the 10% increase which occurred in the EU 27 over the same period. Within this age category, the highest increase was experienced by those aged 75 to 84, growing by 28%, while the EU 27 only experienced a 3.4% increase in the 75 to 84-year age group. While Ireland continues to have a younger age profile than most of the EU, our population is ageing and coming more in line with the EU average. As you might expect, persons in older age groups account for the majority of deaths. In 2019, 82% of all deaths which occurred in Ireland were among persons aged 65 years and over. 29% of all deaths were in the 75 to 84 age group. We know that the number of adults aged 65 years and older is increasing by just under 4% annually, and the number of adults aged 75 years and older is increasing just over 4% a year. The substantial increase in the number of persons in these age groups annually gives rise to an expectation of an increase in the absolute number of deaths occurring in Ireland, compared with the number of deaths which occurred during the years 2016 to 2019. All data on excess mortality are estimates, and as I noted earlier, a large number of different methodologies have been developed by a number of organisations internationally to try to estimate levels of excess mortality. Some of these methodologies are long established, such as EuroMOMO, a European mortality monitoring activity which many while many were developed in response to the COVID-19 pandemic, such as Eurostat and the CSO. It is important to note that the different estimation methods vary considerably in the estimation of expected deaths. For example, the number of years involved in the baseline average, for example, 2016 to 2019, is a 4-year average, while others use a single year. Actual timeline, for example, the years 2016 to 2019 or 2010 to 2013, allowing for seasonal variation, applying statistical significance tests before mortality is considered to be excess. Nationally and internationally, work is currently underway to further refine methods to estimate excess mortality. EuroMOMO, Eurostat and the CSO have published estimates of excess mortality during winter 2022 to 2023 for Ireland. The most recent estimates from EuroMOMO estimate that during winter 22-23, Ireland experienced excess all-cause mortality for all ages during 5 consecutive weeks in late December 2022 to early January 2023. Mortality has been close to or below baseline since the second week of January 2023. EuroMOMO estimates that other European countries, including the UK, Austria, Belgium, Denmark, France, Germany, Italy, the Netherlands, Portugal, Sweden and Switzerland, also experienced excess mortality for a period last winter when flu was circulating at high levels. When considering the EuroMOMO data on excess mortality, it's important to note that influenza activity was at very high levels in Ireland during December 2022 and early mid-January 2023. The number of influenza case notifications to the Health Protection Surveillance Centre in the last weeks of 2022 and the early weeks of 2023 were the highest of any week since 2017. Previously, flu surges of this magnitude recorded similar increases in excess deaths in winter 2017-2018, which was characterised as a severe flu season. While EuroMOMO data is the most robust available, the modelling of excess deaths does not take into consideration Ireland's 4% increase in adults aged over 65 from 2019 onwards. This gives rise to an underestimation of expected deaths and an overestimation of excess mortality. Eurostat publishes monthly estimates of excess mortality, which compares the number of people who died from any cause in a month with an historical baseline for that month from pre-pandemic years 2016 to 2019. Since March 2020, Eurostat estimates that the EU27 has had a higher number of deaths than the 2016 to 2019 average in almost every month. Since early 2022, Ireland has followed a similar pattern. That is, the number of deaths in each month has been higher than the average number of deaths that occurred during the same month between 2016 and 2019. This method does not account for population growth or an ageing population, which significantly underestimates Ireland's expected deaths. As we know, the number of persons in Ireland aged 65 years and over increased by 22%, more than double the 10% increase which occurred in the EU27 over the same period. 82% of all deaths which occurred in Ireland were among persons aged 65 years and over. While both EuroMOMO and Eurostat are based on similar data on the number of deaths which occur because of the different methodologies used to estimate expected deaths and excess deaths, these methods generate different estimates of excess mortality levels. The CSO recently published an update of their Frontier series publication measuring mortality using public data sources 2019 to 2023. Which includes an analysis of RIP.ie death notices and estimates of excess mortality. The CSO adopt a similar methodology to Eurostat to estimate excess deaths, but in the latest release they use a number of different baseline periods to illustrate how the estimation of excess deaths depends strongly on the baseline chosen and to provide a range of estimated excess mortality rather than a single figure for each month. An issue impacting analysis of mortality trends and estimates of excess mortality for Ireland is the time lag in death registration. As I outlined earlier, in Ireland, a legal period of 3 months is currently provided for the registration of a death. In the short term, the response to address the issue of this time lag has been the use of RIP.ie data during the pandemic. Whilst timely and with high coverage, it lacks key inputs such as cause of death and age of deceased. Following a public consultation in 2021, work is currently underway by the Department of Social Protection, General Register Office, Department of Health, the Health Service Executive and the CSO to improve the timelines and process of death registration in Ireland. This involves two main actions. The Department of Social Protection is progressing the Civil Registration Electronic Registration Bill 2023, which will legislate for more timely registrations of deaths, and the development of technical solutions to allow notification and certification of deaths by hospital staff and GPs is underway within the HSE. The technical, procedural and legislative change required will take some time to be implemented. Considerable analysis is ongoing in relation to mortality trends within Ireland. In 2022, neoplasms, diseases of the circulatory system and external causes were the main cause of death among persons aged under 65 years. Disease of the circulatory system, neoplasms and diseases of the respiratory system were the main causes of death among persons aged 65 years and over. Data for 2022 is provisional and based on date of registration of death. The Health Protection Surveillance Centre will continue to participate in the Euromomo network to monitor trends in excess mortality during the upcoming winter. The Euromomo network is also working closely with the ECDC to further develop and enhance its methodology to estimate excess mortality. The CSO is also continuing to examine methods for estimating excess deaths and mortality analysis. Internationally, the Department of Health is engaging closely with the OECD in their work on incorporating demographic change in their excess mortality estimates and the use of excess mortality as an indicator of the impact of climate change. The Department of Health will continue to actively monitor and review all available data on mortality as it becomes available to gain a better insight on underlying mortality trends in Ireland and factors influencing these. The Department will continue also to work with all stakeholders to determine the most accurate estimates of mortality data in Ireland.
This is spoken with Rightless and Party Sinn Féin. Talked to Port Lorga, talk to
David Cullen.
David Cullen. Double SPN. How could I forget?
Oh, well, that's it. And you've represented some of Waterford as well, so.
Indeed, and represented well.
You do indeed. First of all, I welcome the fact that we have statements on the trends in mortality and estimates of excess mortality. And it is important, Minister, that we have clear and factual and evidence-based data put on the public record. Because I think some of the information you have given in your opening statement is very helpful, and I've seen some misinformation and mischaracterisation of some of this topic, particularly online, and I think it's unhelpful. So it's really important that we have a chance to have a debate on this, but also to have factual information. I would also say, Minister, that this is one of the reasons why we need more investment in digital transformation in healthcare, because I know that it is sometimes difficult for the HSE and for the healthcare systems to capture data. We know that data is rich in terms of decision-making in healthcare, and we also know that many of our IT systems across the acute primary community don't speak to each other. We don't have interoperability, and we lag behind other European countries in terms of our digital transformation of healthcare. So I think I just want to make that point at the start. I also want to acknowledge the important strides that have been made over the last few decades in improving life expectancy in this state. And life expectancy at birth is standing at 82 years of age in 2021. This is obviously a positive feature of life in Ireland and demonstrates how far we have come since independence. It is also important to recognise this progress, and part of that progress is to do with improvements in innovations in health, new medicines, new therapies, a better healthcare system, and all of the improvements that we've seen over decades. And all of that has to be recognised as well. We also have, as you said in your opening statement, Minister, an ageing population. And since 2016, the total population has increased by 8%. but the number of people aged 65 years and over has increased by 22%, and the number aged over 75 has increased by 25%. So I think we have to acknowledge that in the context of this debate and what we're discussing here today. The average age now stands at 38, up from 36 in 2011. People are having children later in life, as we know, and there are fewer of them having children. And while some of that are lifestyle choices that people have made, and we know the differences between when people have children now compared to maybe 30, 40 years ago, we also have to recognise that social changes are being driven by the lack of housing and childcare supports, which are preventing young families from forming and settling. And I think government has to address the barriers which young people are facing to avoid or at least mitigate the severe impact that unplanned demographic challenges can and do have on the sustainability of social services. It is not enough just to recognise the progress which has been made. It is essential that we also react to it. And the demographic changes will obviously heap additional pressures on our hospitals, which they cannot bear. And if we do not plan for those demographic changes, then we won't be able to deliver the health services that people need. And I will deal with some of that later when I talk about the existing levels of service funding in healthcare, which we know in part is to deal with those demographic changes and what happened in Budget 2024. Our older people are already funnelled into hospital-based care because of a lack of alternatives at home and in the community. I pointed out to the Minister for Health time and again, and he doesn't need to point out. Everybody knows from the Sláinte Care report and from the very extensive debates that we've had on healthcare that we do need to reorientate the healthcare system to ensure that we have right care, right place, right time for patients. And while we do need to put more capacity into our hospitals, we know that we have to do much more in relation to GP capacity, out-of-hours GP care, make better use of community pharmacy, build on the enhanced community care model that we now have in healthcare, which I welcome, making sure that people with chronic pain and chronic conditions are actually treated and managed in the community where we can, deliver the statutory home care scheme to ensure that people can be cared for in the home. All of these are areas where we need more investment, and all of that, I think, is what's necessary as well as we deal with the huge changes and transformation in healthcare that we're seeing. I also want to acknowledge, by the way, the huge innovation that we're seeing in healthcare. And I'm always blown away when I go to training colleges and I see people who are being trained to work in our healthcare system, and the first-class research and development, training capacity, it's just incredible, and we're at the cutting edge of it. We see it in nursing, but we see it across many areas, and I have no doubt that all of that training, all of that capacity is also leading to better health outcomes when we do get them to come and work in the public system. The problem is, Minister, we don't get all of them, and as we know, as I said earlier, because of other societal problems like housing, unfortunately we're losing some of them now out of the country, and I think that is regrettable. We do need to change our approach on healthcare to focus on improving quality of life and focus on care in the community, as I said, to reduce hospitalisation. Our focus should also be on prevention and early intervention, not just treating disease, but where we can, preventing disease. And again, this is one of the areas in healthcare where we don't talk enough about it, we don't maybe invest enough in this area, and I know that the Irish Heart Foundation and others are actually doing some really good work and research in this area in relation to cardiac disease, because if we can reduce instances of disease, obviously that's more cost effective, it's more beneficial in terms of the management of our health services, but also means that people will live longer and are not going to be in hospital. Long waiting times are also storing up problems and making matters work. They make care much more complicated and reduce the ability of people to, as I said, to stay at home, manage conditions locally and live independently. I do need to take the opportunity, Minister, to raise with you the issue of the deficit in healthcare spending and this year's budget. I know we will have statements in it all on that tomorrow, but we can't have a debate about the impact of demographic pressures in healthcare and avoid having a conversation on the money that was given to the health service last year and this year to deal with that. So one of the reasons why we have what's called existing levels of service funding given to departments is to deal with a number of areas. Pay demands, inflation that we know is running very high in healthcare at the moment, but also the increased population and demographic pressures. And the head of the HSE and the head of the Department of Health in the Oireachtas Health Committee a number of months ago both conceded that last year the health service did not get enough money to stand still. So whatever levels of existing levels of service funding was given simply wasn't enough. And that has in part created what is a big deficit this year, potentially 1.5 billion. Matters were made worse in the budget just gone. We know that the current head of the HSE is clearly on the record in saying that we don't have enough money to run the health service next year. And I understand at a press conference today that the Minister for Public Expenditure and Reform was on the record as saying that it is likely that we will have a deficit in healthcare spending next year. Not only is it likely, but it needs to be pointed out to the Minister for Public Expenditure and Reform that he is guaranteed there will be a deficit next year. And he is also guaranteed that we now have a recruitment embargo in place on the front line in hospitals and elsewhere that's going to have an impact on patient care. And we know from all of the studies that have been done in Britain, internationally and in the European Union, that if people are waiting longer in emergency departments, then people's outcomes will disimprove. And the quicker people can be treated in emergency departments, health outcomes are better. And when you have a recruitment embargo in areas like non-training NCHDs and junior doctors, healthcare assistants, home helps, lots of other areas, that will impact. It will bite and it will have an impact on services. I was in St Luke's Hospital in Kilkenny on Monday of this week, and I met with hospital management, and they told me that they were already finding it very difficult to hang on to non-training junior doctors. They were being poached by the NHS in Britain and elsewhere, and they are really concerned now about the impact of this recruitment embargo and what that will mean. And this is a hospital that actually has improved in terms of patients on hospital trolleys. Another example I'll give you, because it's been talked about so often by ministers, and it's in my own constituency, which is University Hospital Waterford. We've had no patients on hospital trolleys for over 2 years. In part, that was down to a lot of work that was done. There's lots of ingredients as to how that was made happen. But one of them was that the hospital opened up a 6th medical ward, 35 beds. That ward is funded or is allowed to stay open through unfunded posts and agency staff because of the decision that was taken now to scrap unfunded posts, 7,000 of them, and to cut back on agency spend by a third. And I don't have a difficulty with cutting back on agency spend as long as it doesn't bite on services. But I've been told by hospital management in Waterford that they can't keep that ward open now unless they take staff from elsewhere. And one of the areas that they will be taking staff from will be cardiac care, and the second cath lab that was open to deliver the additional cardiac capacity is now not going to be giving the full benefit that it should. So there's one local example, and I'm sure over the course of the next number of days and weeks and months, as we face into a very difficult winter, that this is going to become more apparent. And whatever about excess deaths and what contributes to that and what causes it in terms of the last number of years, and I have been very clear about putting factual information on the Dail record and being responsible when we talk about this. We do know, and it's accepted within the health services internationally, that if you have real pressures in your emergency departments, if people are waiting for days on end on trolleys, and I've spoken to many, many families where that has been a really bad experience, that will have an impact on the outcome, the health outcomes of those patients. One of the things that hospital managers tell us all of the time that they need, as well as all the other investments in primary and community care, to ensure that those alternative clinical pathways are available and people who should not be in hospital but who are there because those options are not there can actually have other options. They talk about hospital beds, and it isn't the only solution, but it is in some hospitals one of them. And as you know, Minister, 3 times last year the Minister for Health promised and announced again very loudly in one of the Oireachtas Health Committees 1,500 rapid build beds, and they seem to have dropped off the face of the earth. Certainly no additional funding was made available in the budget, and we don't know now if those beds will be funded at all. Without those beds in hospitals, we won't be able to give the additional capacity to hospitals to be able to deal with the issues in emergency departments. And that, I have to say, is going to be on the government and the same Minister for Public Expenditure and Reform, who, thinking out loud, was saying, as if he wasn't a direct contributor to it, that we're going to have a deficit in healthcare next year. He made a deliberate decision to underfund the health service and all of the consequences. I'm also concerned when I look at all of the clinical programmes, and I've spoken to some clinical leads across healthcare as well: cancer, cardiovascular, diabetes, in maternity, all of those areas. They need year-on-year additional funding to advance, to deliver on their strategies. The health service has been starved of additional funding in all of those areas. If anybody believes that that won't impact on the future of healthcare services and patient outcomes and patient safety, they're living in cloud cuckoo land. It is going to have a real impact. I've given an example in my own county in the acute hospital there what this will mean, but we're going to see it right across all of the clinical programmes, the national strategies. Every strand of healthcare have been starved of any additional funding. And worse than that, we haven't even provided the health service with enough money to stand still. So given what we've already seen with a recruitment embargo, 7,000 jobs scrapped, 1,500 rapid beds that it seems have now disappeared in a puff of smoke, all of that's going to bite, and I think we're going to see more. And that big black hole that you guys created in healthcare is now going to be bigger next year because of the deliberate strategy of this government to do so. Maybe you think it's good to leave it to the next government, and we've said you've thrown in the towel on healthcare. Maybe that's the case because you've given up that you won't be in government next time round, and sure, leave it to the next government. But it's irresponsible, because if you talk to anybody who understands how you fund healthcare, there has to be certainty on funding. And in the absence of certainty on funding, there is chaos, there is confusion, and we need multi-annual funding and accountability in healthcare, and not cuts. And the final thing I'll say is this, because I've listened very carefully to what government representatives have said in response to all of this, trying to pivot and shift this onto the HSE, and the HSE is wasteful and we need reform. Well, there's nobody has been shouting that more loudly than me. We do need to reform the HSE, and there is waste. And I've been pointing a lot of these areas out in relation to management consultancy, outsourcing, agency spend, all of that. And only now the government is waking up and saying we'll do something about it. But even if you delivered all of that, at the best estimates, it still wouldn't come within an ass's roar of dealing with the deficit. So I'm very concerned about all of that. I'm pleased that we had this debate on the excess mortality and those issues, but I couldn't let that issue of the budget go without putting those points on the public record. Thank you.
Chair. I welcome the opportunity to debate this here today, because it's a difficult one to discuss for a number of reasons. I mean, your own opening statement, Minister, I found was really helpful and very honest in terms of the difficulties and the complexities within the epidemiology itself of how to actually calculate excess mortality, and they're very real difficulties and complexities. But I think this was first, introduced to many of us and to me through online debates during COVID, particularly the misinformation wars that took place, where excess mortality was weaponised as a phrase to target the government and the state and health service response to COVID, which we could talk about till the cows come home, but overall in terms of vaccination programs, in terms of the response from our health service and our frontline workers, was a great source of pride in terms of what our workers did, what our healthcare workers did at the time. And I think collectively, the country did try to do its very best. But that's where I first was came to realise this term excessive mortality on a regular basis, and to dig down into it. And look, the data on excess deaths, as you said in your own statement, is very difficult to calculate and to agree upon. And there's huge sensitivities to it as well. So when you're debating the different methodologies, it's not like debating methodologies in other parts of social science or anything like that. When you're dealing it in relation to deaths, it hits far deeper and cuts far deeper. So there are huge sensitivities to it. But the data on excess deaths that come from Euromomo or Eurostat, the accuracy of the data, as I said, is disputed with Eurostat, showing 16% excess death rate in Ireland. However, the data has been partially collected from RIP.ie, which, as you mentioned, doesn't include a key piece of information, such as the age of the person who's passed away or the cause of death. I mean, these are very real pieces of information that are needed if you are to be calculating excess mortality, as it can be as a result of a number of things, including issues with our healthcare system. And that's, I suppose, where we really want to get to if we are examining excess mortality are we experiencing high levels of excess mortality, and is that due to a failure in our healthcare system or another failure in our state? And we're not there yet in terms of being able to stand over any kind of methodology to rigorously examine that. And the lack of accurate data tracking excess deaths is a concern. Because we do need to get to a place where we are using this data to ensure that we're planning for our health service, we're planning for our HSE, we're planning resource allocation, and of course the last 8 days we've been having a huge debate. We're going to have a big debate tomorrow, and rightly so, about resource allocation, about funding for our health service. Because ultimately, why do we want to fund our health service? Why does it need funding? It needs funding because sick people need to be made better. People that are very sick, we have to avoid them passing away. So it is important. It is vitally important. The lack of funding for our HSE in the coming year, as has been further copper-fastened both yesterday and today by the Minister for Public Expenditure Reform, who really seems to be calling the shots here in a very hard-headed and heavy-handed way, is an absolute disgrace, and it is going to cause harm, as Bernard Gloucester says. And I said yesterday in speaking with the press, when you are causing harm in our health service, that means sick people will get sicker and very sick people are going to die, and that's the reality of it. And where we see the impact of this, as predicted by Bernard Gloucester, the Chief Executive of the HSE, if he is going to try and protect accident and emergency and access to our healthcare system, it will be our clinical strategies that are going to be impacted. So we're talking cancer strategies, we're talking diabetes strategies, sepsis, our biggest killer, heart disease, another one of our biggest killers. These are the areas that are going to be impacted by the recruitment freeze and the lack of funding. And this is the reality. So, when we're measuring the impact of this in terms of the harm caused, we are going to need to be able to compute and rely on and have trust in any kind of excess mortality methodology. We're not there yet. And of course, the best way to decrease deaths and to not have excess mortality is to have a functional, properly funded and resourced healthcare system. And none of us in this House, hand on heart, including the Minister for Health, can say that given this budget and given where we are and where we're going, that we will have or do have a functional, properly funded and resourced healthcare system, because it has been shown and demonstrated clearly over the last 8 days that we will not have that in the next year. Thank you very much.
Well, Michael Gush, it's Dr. Rashkery and Regis. I should talk to Colin Burke. Then we'll have this.
Thank you, Las Cloncura. Minister, first of all, I think we need to be very careful about how we use statistics. 1 month's figures do not make a trend. We also need to be careful of using figures from unofficial sources. The CSO published quarterly reports on vital statistics, which include births and deaths. Quarter 1 figures for 2023 were published on August 25th. As regards death registration, they correctly point out that many actual deaths occurring in a particular quarter may not be registered until the following quarter. They indicate that of the 10,205 deaths registered in Quarter 1 2023, only 59% or 6,062 deaths actually occurred in Q1. The remainder of the deaths registered in Q1 actually occurred in the fourth quarter of 2022. A similar pattern emerges for every quarterly death figure. The CSO has now produced figures for its best estimate of deaths actually occurring in any one quarter. Its estimate for deaths occurring in Q1 2023 is 8,413. For Q1 2022 is 8,858. For Q1 2021 is 10,037, and for Q1 2019 is 8,618. The CSO figures indicate that there is no great difference between the first quarter of 2019, which was pre-COVID, and the figures for the first quarter of this year. However, there are two factors which will contribute to rising death numbers in the years ahead. One is a changing age profile of the population. CSO figures show that between Census 2016 and Census 2022, the number of people in the age group 75 to 84 increased by 28%, and the number of 85s plus increased by 25%. Figures released in the last few days show that the average life expectancy in Ireland was 71 years when we joined the European Union, and according to HSE figures released in August this year, life expectancy in Ireland is now 84.4 years for women and 80.8 years for men. So people may be living longer, but of course death comes for everybody sooner or later. An ageing population will result in higher annual death rates over time. The other factor which will over time also contribute to higher deaths is the overall growth in population. The Irish population has increased by 1.5 million people since the year 2000. That's a 40% increase in 23 years. A rapidly rising population will inevitably see a rise in the number of actual deaths from the wide variety of illnesses and conditions which can occur. Some people are using RIP.ie as an accurate measure of deaths in any 1 month. I'm not aware of any research by any academic institution on the accuracy of RIP.ie figures. RIP.ie figures may well serve as a useful measure of monthly deaths, but to repeat 1 month does not make a trend. And of course, many people in older age groups dramatically reduced their social contacts during COVID, while others may have delayed medical checkup. When COVID restrictions were eased, an increase in deaths might be expected. For a variety of reasons, there are always higher deaths during the winter months. We do know this, however. Every winter, the flu kills many people and causes hospital overcrowding. Getting the COVID vaccine and the flu vaccine and following public health guidelines on the prevention of infection will reduce the number of deaths and reduce hospital overcrowding in the winter months ahead. And I think it's important as well to acknowledge the work that has been done in our health service over the last 20 years. And I noticed that my colleague David Conan has acknowledged the contribution that the health service has played in making sure that we have an increased life expectancy, an increase of 11 years in the last 50. We've gone from 71 to an average of 82 in relation to life expectancy. And a huge contribution to that is obviously people are more aware of how to mind their own health, but also the contribution that our health service, that our GPs, that our doctors, that our nurses, that our hospitals play. And in fact, in the last 20 years, you look at the changes that have occurred in healthcare. For instance, you take where long ago you went in for a procedure and you could be 4 or 5 days in hospital. Now an awful lot of those procedures are day procedures and people are in and out faster. So the volume of patients that are being seen in our hospitals has increased dramatically and that are being seen in our clinics. And you take, for instance, people saying, on an average day to you, they'll give you out somewhere or other about the health service. But what they don't realise is that over 3.5 million outpatient appointments last year, 3.5 million. That's over 66,000 people a week going into our hospitals for care in some form or other in clinics. And I think it's important to acknowledge the work that's done in that area. But the one challenge that we now have, and I think it's important, Minister, that we take note of this, and that's the challenge where we have this latest CSO figures show that there are over 805,000 people now over 66 years of age. That's a huge growth in population in that age group. It also means that by the year 2030, that's only 6 years away, in fact, it will be 1 million people over 66. And we need to make sure that we can plan for that and that we now deal with the whole area of home care and step-down care from hospitals. And I find it frightening that while we are debating this issue here today, there are 600 people inside an hospital who could be discharged, but we have not a coordinated mechanism in place to get people out of hospital in a timely manner. And I think that's one issue that we need to deal with. And necessarily, we need to build step-down facilities so someone can get into a step-down facility for 3 to 4 weeks and out of the hospital care, because the cost of hospital care is extremely expensive. It's up to 7,000 to 8,000 euros per bed per week, whereas a step-down facility would cost at most 2,000 euros per bed per week. So we need a lot of work to be done in this area. We need a lot of work to be done in relation to home care. We now need to have a more, attractive package available to get more people into providing home care. And you take, for instance, the figures in this Kerry region, the southwest region, we'd have over 1,800 people employed by the HSE providing home care 2 years ago. We lost 400 of those. I know, in fairness to the HSE, they've recruited more people, but we've not still recruited a sufficient number of people to provide the packages that they require. I have one lady, for instance, who was on to me in the last few days, where she's 90 years of age, she has to use a walking frame to move around her own house, she's living on her own, and the best I can get for her is 1 hour a week of home care. That's not sufficient. And we've got to look at this whole area. How do we provide an attractive package to bring in people into that area and to give them the support so they can help people to live in their own homes and live there securely and have the additional support that they require. And then, of course, the other issue, Minister, that we need to look at as well is that we're going to have a lot more people living on their own, where families have moved away from their own location. They might be working in Dublin, they might be working in other parts of the country, and it's not as easy, especially if you have children who themselves have young children. They're not able to give the same amount of time to their parent as what they would like to give, and therefore the importance of home care needs to be further looked at and delivered on, and how we can attract people in, and also how we can try and get back people who were providing home care, who have left the system. What do we need to do in relation to making that attractive and make it? The other issue, Minister, as well, we need to look at the whole issue in relation to step-down facilities, and I raised it earlier, but I'm not satisfied that we have a sufficient capacity in our home care area, in our step-down facility area. And in particular, when we now come into the, even the October bank holiday weekend, will we have admin people on call during that weekend to assist doctors? If a doctor comes in on the bank holiday weekend to discharge someone from the hospital, and that person doesn't have the necessary supports at home to go back to their own home, do we have admin people there to make sure that the suitable step-down facility can be identified so that person can get out of the hospital on the Saturday or the Sunday of a bank holiday weekend, and likewise during the Christmas period? So it's fine to say we need consultants to be working on Saturday and Sunday to discharge people, but we also need to have that administrative support in place on the Saturdays and Sundays as well, to provide to make sure that we can deliver in a timely manner the step-down facility that the person requires. And I think they're the things that we need to start focusing on. And in particular, you know, I said about the population rising by 40% in 23 years. We haven't grown the number of hospital beds by 40% in 23 years. And part of the reason for that is because, as I said earlier, we have an awful lot of procedures now that don't require admission to hospital, but are daycare procedures. But that means still that we still have a huge growth in population. We now need to plan to cater for that growth and to deliver the infrastructure and deliver it in a timely manner. So again, thank you, Minister, for bringing this debate forward, and I think it's important that we get accuracy in the figures in this area. Thank you.
We're now going to talk to Burke and Nish, but we're right as a party Sinn Féin, and talk to Rory Murco, Cui Nomaid.
Gurum Maigut Kahirluk. Minister, look, I think this has been a useful exercise in the sense of an awful lot of information has been put out there by yourself and others, and in fairness to Deputy Burke, he had no difficulty in reaming off a whole load of useful figures, and because sometimes, you know, particularly since we've entered into the COVID period, we have been dealing with an awful lot of disinformation and misinformation, and in some cases people who will misabuse and disabuse the data that's out there, and then others that sometimes just fall prey to this. So that's something that definitely needs to be dealt with. Now, when we are talking about, you know, older people, I would say there may be a lack, there is a lack of statistics in relation to the, you know, information that needs to be collated. In fairness to Deputy Cullinan, he also spoke about the whole idea of we still need to see that digital transformation. We know the issues that there are in relation to systems within the healthcare. We know as regards having proper operating systems in relation to, you know, patient information and patient care that allows for best practice and best case outcomes. And look, we all know the issues that pertained as regards the HSE and the fact that there was an element of vulnerability from outside attack, which obviously in this day and age is something we all have to be prepared for. When we need systems to be interconnected and to communicate to each other, we also need to make sure that we have the relevant levels of protections and firewalls and ensure that we can at least mitigate the dangers that exist in this particular day and age. Now, I will return to an issue that I've brought up many times before, and I suppose that is the idea of elder care, and I'm talking in particular about during the COVID period. I'm talking about the fact that I thought at this stage we would have some further information in relation to what the inquiry in relation to the state's reaction to COVID would be, and what we're going to talk about particular modules. We know that there were a number of issues in relation to nursing homes. I'm going to talk specifically about Jalgan House in Dundalk, where 23 families suffered a loss of a loved one during the COVID period, and they have interacted with many ministers at this stage, and many other politicians across the House in relation to getting those answers. So on some level, they are, it'll be 3 years next month in November when a small number of the families had met with Minister Donnelly to ask him to get answers to their questions. And in fairness, he had spoken about that people required some sort of mechanism or device to provide these answers. Now, these families have been incredibly brave, incredibly resilient, and between FOIs and occasionally when a politician has been useful from the point of view of a PQ, they have provided a huge amount of information, but we really need to get down to some form of investigative stroke an inquiry that can provide those answers. And those answers are needed also from a point of view of delivering. We constantly talk in here about best practice. We constantly talk about learnings. Well, I think we should set in train what's necessary to provide these families with the facts, any of the questions that remain, and there are questions for whether you're talking about the nursing home, whether you're talking about the HSE and all the others that were involved in relation to it. So I think that needs to be done, and then we need to see and make sure that we have protocols and that we have best practice in relation to how we go forward in relation to elder care in general, and also in relation to dealing with the possibilities that may happen in the future as regards pandemics. Now, we all hope there are enough dreadful things going on in this world, and we do not want to see this beyond that. Minister, I had about 14 different points I was going to make, but I think that they will stay for another day. Just in relation to your own particular remit, I'm going to address the fact of the Family Addiction Support Network, which did get an element of funding for a very specific project through the Community Innovative Funding Stream through the Department of Justice. But we do need to look at what was in the Gearan report around providing them with the capacity to sustainable funding rather than living on the basis of volunteerism and fundraising and all those which isn't sustainable into the long term. Thank you, Deputy.
From the outset, I have to say that I wonder about the motivations behind this debate, and I just also want to note the fact that some of the people who are loudest in calling for this debate are not present for it at this point in the chamber. I think one only has to do a cursory search of excess deaths on social media to find any number of conspiracy theories and anti-vax content. I'm not by any means saying that we should ignore excess mortality, the statistics for that, because they are important, but we should question the framing of this data by some, along with the reliability of some of the sources. When it comes to excess mortality, the two most commonly referenced sources are Eurostat and Euromomo. However, as Professor Anthony Staines recently pointed out, their findings and data sources are very different. For example, Eurostat, which collects data from RIP.ie, has repeatedly reported high excess death rates in Ireland. For August, it reported excess deaths of 21.1%, the highest in Europe. However, Euromomo, which the Health Protection Surveillance Centre participates in, found that Ireland has been in the normal range with no substantial increases in mortality since March. One of the issues with Eurostat is the methodology. It compares the number of people who died in a given period against a historical baseline, 2016 to 2019 in this case. This does not take account of rapid demographic changes or a population that is ageing faster than anywhere else in Europe. When we interpret this data, particularly around winter, we must also be cognizant of waves of COVID, flu, and other respiratory illnesses. In respect of COVID, then, in the first 3 months of the year, there were 307 deaths as a result of the virus. That's about 13 people a week. In terms of the flu, between October 2022 and March 2023, influenza infection led to 170 deaths. Another factor which must be considered when looking at the winter figures is hospital overcrowding. Analysis of HSE data by the Irish Patients Association found that more than 1,200 patients have died last winter as a result of delays in hospital admissions. When this figure was put to Fergal Hickey of the Irish Association of Emergency Medicine, he said these estimates were, and I quote, probably conservative, end of quote. Addressing these avoidable deaths must be a key priority for the health service as we enter into the winter months this year. Nonetheless, nonetheless, I do not believe that there is evidence of any hidden or sinister reason for excess deaths in winter, aside from our health system's predictable yet unacceptable inability to deal with winter surges. Unfortunately, it is difficult to envisage any improvement this year when we have a government that continues to underfund the health service relative to the demand. It's almost as if this government is oblivious to the changes in demographics, the impact of inflation, and has given up on reforming our health service. And, much of that additional funding that was required this year was to maintain the momentum and keep the progress going in relation to the implementation of the reform programme that is Sláintecare. And the question has to be asked, where does this stand now, given the fact that the funding falls so far short of what is needed? For example, what happened to reviewing our model of elder care? In April 2020, the then Minister for Health, Simon Harris, said that the current model was, I quote, not fit for purpose, and that a serious conversation about elder care would be required after the pandemic. We're still waiting for that serious conversation. I accept that the Commission on Care is due to begin its work next year, but it is still not clear if it will examine the increasing privatisation of older person services, and this is key to the model of care. A month after Minister Harris's comments, the Taoiseach also said that we needed to consider alternatives to nursing homes, such as, and I quote what he said, more and better home care. And yet we know with the home care budget that was provided this year, the allocation that was due to be almost 24 million hours, that this is being cut back in order to meet the commitment to pay the staff properly. So in fact, older people needing home care are paying the price for what we should have been doing anyway, which is putting home care workers on a proper financial footing in terms of their pay and conditions. So it's extremely disappointing that those improvements in pay are coming within the same envelope, and as I say, that older people are going to be paying the price for that. It's very disappointing, not least following the downward revision that has happened in relation to the loss of almost 2 million hours, and in addition to that, of course, the considerable number of people on waiting lists. Also, why has there still been no movement on the statutory right to home care? 5 years after the commitment to introduce a statutory scheme, we still don't even have the heads of a bill. If we were serious about this, if we were committed to introducing a new model of care, we would put much more energy and time and effort into ensuring that that long-standing commitment was delivered on. Unfortunately, it looks to be some way off still.
Thank you very much, Deputy Shortall. We now move to a government slot. We're going to hear Deputy John McGuinness. Deputy, you have 11 minutes if you need them.
Count Corla, I suppose the general discussion outside of this House in relation to COVID and what went on at that time will range right across the spectrum of conspiracy theories, some facts, and then I suppose a listening ear to decide what is best to do in relation to explaining to people just what happened. Now, I know that during COVID we had a lot of lockdowns, but people that were elderly in homes, I think, felt it more than most. And those that died during COVID had to do so without the general support of their own families. Now, I think that the issue around COVID, the vaccinations, and what people thought at the time, plus the deaths and the disturbance and, I suppose, trauma caused to families, did spark the debate around the numbers of people that were dying. We had a committee here in the House during COVID. I was a member of that committee, and we were discussing in detail just how people were to be looked after, our response in real time in terms of the department, the various frontline staff, and so on. And I think it would be worthwhile now to look back on that and to have a discussion, a look back, and learn from just what exactly did happen during COVID, and address then the issue of the increase in deaths since COVID. Some people consider that there's a lot more deaths now than by comparison to previous years and by comparison to the normal expectancy. And I beginning to think that there is an unusual number of deaths, and therefore we should look at it. We should try to understand what is the cause of that. I do accept that we have an increased ageing population, and that will explain some of the numbers. But what shocks me in my own county is the number of young people that are dying, the number of cancer cases that are being reported, and the range of the types of cancer that people are suffering from, and that some people have died from. And we should educate ourselves in relation to what is happening, and we should try to understand, what types of cancer and maybe where those cancers come from. I know, again, learning from my own constituency, where factories were blamed for the high deaths, for example, in Castlecomer and North Kilkenny, and the Department of Agriculture, because there was a farmer involved in that, Dan Brennan, we've had a debate here on it and at committee, at the Agricultural Committee. He only found out after the fact that when the factory closed, all of his animals and all of his farming activities improved immediately. So the adverse effects of that factory, it is clear that the adverse effects came from the emissions from that factory. And he was caught in the geographically located across from the chimneys of the factory. So instead of dismissing that as something that is irrelevant or something that didn't happen at all, which is often the case when we discuss issues like this, because they can be, as I said, associated with conspiracy theories. But when you get into the detail of them, for example, Dan Brennan's case, you discover that certain things were happening at the time. And in fact, all of the tests carried out by the Department of Agriculture on his animals, and indeed on the growth of trees and how they were affected, all of that stopped some time after the factory was closed. So we need to understand what was in the air at that time that caused all of that to happen. And similarly, we need to understand in relation to either vaccines or cancers, unusual cancers, why is all of that happening? Now, I've read emails that came into my office from one individual who lives in Kilkenny, and I've read reports on it in terms of the numbers that have died. And because the numbers are so different by comparison to other years, I think that in itself should set off at least some alarm bells and should focus the minds of those in authority on why that is happening, setting aside the growing age
of our population. And I believe that if we were to do that, we might dispel some of the, the extreme explanations that we would read, and we would address the reasons why it's happening and learn from those reasons. So I would certainly support further investigation into the numbers. I certainly would not support the argument being dismissed on the grounds of it being something that's made up or coming from sharing stories on the internet or elsewhere. I think that there is a basis here for a discussion, and we're having it here in this House, but for some action to be taken. And as well as that, I think we have an obligation to allay the fears of those that are very concerned about the number of deaths. I looked at spoke to our own undertaker in Kilkenny, and he too is very surprised by the numbers. And some of the offerings on YouTube will tell you what is going on or what they believe is going on. So taking the extreme elements out of it again, I believe that we should look at it. I think in any look back around where all of this is coming from, should really take into account what was happening in our nursing homes at that time. And we in this House decided to recognise those that were working on the front line during COVID and after. And it's amazing the number of people that have been excluded from the payment of that COVID payment. And that should be looked at as well. We shouldn't just say, well, that was for another agency or group to look at. If we're serious about these things in health, then we owe it to ourselves and the next generation to examine what's being said. But we also owe it to those that work on the front line now to understand why they were not paid. They seem to have a legitimate argument. When you put it to ministers, you're told that it's really not their decision. But if we made the decision in this House, which you did, and we've paid out significant money to those that were on the front line and entitled to it, then I believe it is time to look at those that feel they have been left out. And that's, in a way, the same principle as looking at an argument that looks to be extreme now, but on examination, it may not be that extreme. So instead of pushing to one side the loud voice on the other side of the argument, just because it's connected to something odd that might appear on the internet, we should actually be taking more on board in our deliberations as to what might have been the case, or as to why the particular argument is being made. So in short, I believe the numbers are very high. I believe that they're unusually high. And I believe it is important that the Department of Health, the government, and any other department should be looking at this to determine why and to learn from what has happened in the past. If we don't do that, well, we could be just storing up a problem for the future. And any new vaccine that would have come out during that time very quickly, it is due to be appraised anyway. It should be looked at because of the fact that it suddenly came from nowhere that we had a vaccine. Is it the best? Can we do better? Are the complaints around that issue valid, or are they not? And I think the population out there of people that want answers is such that we should facilitate some form of look back and determine what those answers should be. Thank you.
Thank you, Deputy McGuinness. Now, Deputy Paul Murphy, please.
Thank you, Ceann Corla. I think there's two issues here that need to be separated. One is the question of whether there is excess mortality, whether there are excess deaths. And the second question is, if there are, then what the cause of those are, because I think the two are often intertwined, and I think the subtext of much of the discussion around excess deaths, unfortunately, is an implication without foundation that these deaths, or a significant proportion of them, or whatever, are being caused by vaccines. On the data point, we need to hear more data, but I do think on the data that we have available so far, in particular from Eurostat, there are reasons to say that there is excess mortality in multiple European Union countries. Actually, it wouldn't be Eurostat, but multiple countries around the world, and in Ireland. The point has been made about August 2023, in that month, Ireland having the highest rate of excess deaths at over 20%. We know that life expectancy has fallen around the globe. So I think there is some evidence to suggest that there is something happening here, and then the question is, what is it? And in my opinion, the first and most obvious cause of this rise in mortality is COVID, which did not exist before late 2019. COVID is still a significant cause of death in Ireland. It may be the case that the political establishment, much media commentators, everyone would wish that COVID has gone away. COVID's in the past, something we talk about in the past. But unfortunately, it hasn't gone away. It's simply the policies that have changed, and the policy of effectively letting it rip and close our eyes to it is the dominant policy now worldwide. 954 people in Ireland have died from COVID since the 3rd of January 2023, including 84 people in the last 4 weeks. In particular, a lot of people, a disproportionate number of people, are still contracting COVID in hospitals and nursing homes, where they're particularly vulnerable and where it can result in the deaths of people quicker than otherwise would have been the case. Another explanation that I think is likely to be a factor here is post-COVID morbidity, that you have higher incidences of heart attacks, strokes, chronic diseases like diabetes and neurological problems in the months and years following a COVID infection, therefore contributing to excess deaths. This may even get worse over time as people suffer repeated reinfections. A recent major study found a substantial rise in risk of cardiovascular disease, including heart attack and stroke, for at least a year after COVID infection. For many people, this can manifest as higher blood pressure, a long-term silent killer that can add to excess mortality in later years. Another explanation is delayed access to healthcare, such as delayed cancer diagnosis during the pandemic, leading to less effective treatments and higher mortality. That is combined with a general backlog on the health system in all areas, including of lots of non-fatal areas post-COVID, exacerbated, of course, by years of underfunding, repeated for next year, a recruitment and retention crisis that will be worsened by the recruitment freeze that has been announced, and an increased population over the last few years, which further stretches resources. This has led to very long waiting lists and hospital emergency department overcrowding, both of which lead to greater mortality. For example, the Irish Patients Association estimated in February that A&E overcrowding had caused 1,300 deaths last winter, and the IMO president, Dr. John Cannon, said in April that, quote, "It's now inevitable that overcrowding and understaffing in the health service is causing avoidable fatalities." I also want to link this to the question of long COVID, because I think, I made this point earlier in topical issues, in years to come, I think that we will look back at the current policy around the world in relation to COVID, and we'll see it as a social crime in terms of the millions of people who have died from COVID and are still dying from COVID, many of those deaths being avoidable. Also, though, a social crime in terms of the tens of millions of people who are being confined to an extremely marginalised life, who are not able to go to work, who are not able to go to school, who don't have their conditions recognised, who aren't getting the support that they need. And I think that is really utterly scandalous. People suffering from long COVID have been found to have higher mortality rates. One study of tens of thousands of people with and without long COVID found that people with long COVID had more than double the mortality rate within 12 months compared to those who hadn't caught COVID, 2.8% versus 1.2%. Quote from the study, based on the study, individuals diagnosed with long COVID are more than twice as likely to need care for cardiovascular events and 3.64 times more likely to have a pulmonary embolism. So I think that the likely root of the likely increase, or the likely cause of the likely increase in mortality of excess deaths is pretty obvious. It's staring us in the face in terms of the pandemic that we've been through and the policies that we've decided to follow. I certainly haven't gone along with those of effectively pretending that this doesn't exist anymore and not taking long COVID seriously. I think there should be a real call on the government and a demand on the government to take long COVID seriously, to implement the measures that were agreed unanimously by this Dáil last November, to properly invest in long COVID clinics, to ensure that they're operating every day of the week, to ensure that they're accessible to people across the country, to take COVID seriously, to take ventilation seriously, to have a reintroduction of masking in healthcare settings, and have education of people of the fact that COVID is still with us, but also of the dangers of long COVID, as well as education of GPs to ensure that people are being referred to the proper pathways for long COVID.
Thank you, Deputy Murphy. Deputy Barry Cowan.
Ceann any discussion or statements in relation to mortality and excess mortality today, of course, must take account of our very recent past and the difficulties and the terrible deaths associated with COVID. And we commend the government, the health services and the ongoing schemes associated with ensuring everything is done to help and assist those who remain at risk. And I think of the vaccination schemes and so forth that are ongoing. But generally speaking, and in the main, obviously we are living longer. Thankfully, we are a lot healthier, making progress in recent decades in relation to heart disease, in relation to cancer care. And it's incumbent on us to pay tribute to all those that work with our elderly, both in care settings and in the communities, and of course families who care for their loved ones and ensure their lives are fulfilling and lengthy. Mental health, too, is an issue for all ages, but in this instance we want to acknowledge the difficulties associated with the elderly and the difficulties associated with their mental health. And we again, should not be shy about committing to and assisting and congratulating and working with all those who help in these spheres. Volunteers, men's sheds now active across many communities, women's sheds being initiated in many places, active retirement groups, family and community resource centres, cultural organisations, all now thankfully embracing and ensuring that retirement and aged is an opportunity for many to enrich their lives, and the government should continue along the path of insisting and helping and assisting those to ensure that that is the case. The healthiest surroundings for anybody of an age that are aged, that need care, is obviously in the home and in their own communities. And the Fair Deal scheme, helps and assists and provides necessary funding for those who necessitate nursing home care. But many homes built 30 years plus ago are not compatible with the needs of the aged or those that need care. And local authority schemes that assist in providing funding to make homes and to adapt homes are fine, but there's never enough. And there are many waiting lists, and I know my own county, and I'm sure in others too. But if it were such that Fair Deal scheme could be extended to allow for house adaptation, to allow for the new, low-carbon economy for a retrofit. And if SEAI could be involved in that scheme, if I use this opportunity for nothing else, only to impress upon government the use and the assistance and the value that could be associated with that initiative as compared to the costs associated with nursing home care. And those people we speak of who would then have an opportunity to remain in their homes, to remain in their communities, to have their families who are committed to them in such a better, a more graceful and altogether more appropriate surrounds. But then I'm sure the mortality rates that others talk about being declining, which I don't necessarily agree or attest to, but we could increase again the huge progress we've made in that regard in recent times. So just merely, Ceann Comhairle, when I noticed this debate taking place, I took it upon myself to take the opportunity to seek to impress upon government the prospect of extending the Fair Deal scheme to cater for house adaptation, to cater for making those homes available where there is a willingness on the part of the occupants and their families and their communities to ensure they play a participative role in the community right throughout their lives, rather than in the first 3 quarters of their lives. Thanks very much.
Deputy Father Tobin.
Ceann Comhairle, Aontú has been raising serious concerns over excess mortality now for 2 years. There has been a prolonged period where month after month where mortality figures have been far in excess of the normal in this state. We've been doing so through debates here, through parliamentary questions and in the media, and it's been of deep frustration that the government has not been taking this issue seriously at all over the last 2 years. At different points in the last 2 years, there's been clear evidence in relation to excess mortalities. If you talk to people in mortuaries, if you talk to undertakers, to priests, to doctors, they will tell you that excess deaths have been peaking over and over again in the last 2 years. The Irish Examiner carried out a review over RIP figures, which showed that in the winter 8 weeks last year, there was a 20% increase in mortality figures over the previous year. And the previous year was in itself a COVID death spike. An incredible situation. And actually, if you take last year's spike in deaths and you compare it with pre-COVID, there was a difference in 3,000 extra deaths in a period of 8 weeks over the pre-COVID years. Incredible figures. Now, I've asked Stephen Donnelly in parliamentary question after parliamentary question, now going back 2 years. First of all, did he accept that there were excess deaths? Secondly, did he know what the cause of those excess deaths were? And thirdly, what actions was he taking in relation to ameliorating or fixing the health issues that were so significant? And in all of those questions, in fairness, Stephen Donnelly admitted to me that there was a significant level of estimated excess deaths, and he pointed to the Eurostat figures of certain months being well over 13, 16, 19% more than the average pre-COVID in relation to excess deaths. And even, for the last 12 months before this June, every month was up in relation to excess deaths. Now, the frustration thing, the shocking thing about this is that while COVID was going on, logically, excess deaths were front-page news, there were primetime news, there were 9 o'clock news issues. And yet, when COVID receded, the issue of excess deaths became completely invisible in terms of political discourse and in terms of media scrutiny. And I want to know, why is that the situation? Why is it that the government have, in general terms, admitted that there's a problem, haven't made the effort to investigate why there's a problem, and really haven't put in any resources to actually tackle the problem? Why has the government been backwards in terms of dealing with that particular issue? It's incredible as well. I've asked the Taoiseach about this question. He said he admitted that it was the case, that there were excess deaths, and he said he'd go to the CMO to find out what the issue was, and he never came back to the Dáil with a response from the CMO. In a bizarre twist, actually, a gripped journalist just in the last 10 days asked Stephen Donnelly what did he think of the excess deaths and what was he doing about it? And Stephen Donnelly said he didn't know anything about excess deaths, even though he'd answered 3 questions in the previous year admitting that there were significant excess deaths happening. So there's something really strange in relation to the way that the government has been dealing with this. Now, I do understand that we live in a political system where there is a significant level of group and herd mentality, where political parties, especially the political establishment, tend to think as one, unfortunately, on a range of different issues. But this is a little bit more. And the reason why I think it's a little bit more is because the government made significant decisions in the 2 years of COVID that had major consequences in relation to people's health. The government closed down significant elements of the cancer services. Now, this was a major mistake, and I stated so over and over again in this chamber. 480 people get cancer every day in this country. 24 people die every day of cancer in this country. No public health system that is doing its job would close down the treatment for patients with cancer. And actually, I had skin in the game at the time because I got cancer in the middle of the COVID situation as well. And I delayed my treatment significantly because we were told not to go to GPs, not to stuff GPs up, not to stuff A&Es up because of the issue surrounding COVID. And actually, the current Taoiseach to the previous Taoiseach ridicules me for stating that the government should not be closing down cancer services at the time. Quite extraordinary response from the government. Now, also, heart disease, stroke, mental health services, all of those treatments were significantly reduced during COVID. Now, it wasn't just us, Aintu, who was pushing back against this. We had clinicians, we had senior medics who were saying that government were making a mistake, saying that there would be a tsunami of far more advanced illnesses hitting the health system in the near future if the government didn't intervene. And the government kept sitting on their hands in relation to this. They even closed down the screening cancer services in this country. And also in terms, I've done a good bit of work in terms of TUSLA figures in recent times, and there's been a radical increase in the number of children who are being referred to TUSLA. 77,000 children last year, 83,000 this year, more than actually do the Leaving Cert now are referred to TUSLA on an annual basis. And I've spoken to people in the sector, and they've told me that a significant reason of this is because schools were closed down in this state for longer than practically any other European country. That critical services that help children in difficulty were closed down, and mental health services were closed down. Now, I believe that, and we've been calling for an investigation into what's happening in relation to excess deaths and in relation to what happened during COVID, but the government have refused to do it. And, the government said maybe there should be a review. It should not be public. There shouldn't be this is not about actually pointing fingers or getting anybody into trouble. And yet there's no concrete plans in relation to carrying out an investigation. An investigation is critical for the first reason. We need to make sure that the mistakes that happened during COVID never happen again. We need to make sure that you have a situation where nearly 10,000 older people are pushed out of hospitals into nursing homes, many of them not even tested for COVID, and seeding COVID in those nursing homes in the most exposed area to the illness in the country and causing thousands of deaths. We need to make sure that that never happens again. But we also need to make sure that there's accountability in the system. And there's no accountability. The reason why the government are pushing back against an investigation into what happened into COVID is because the government know themselves that they made major mistakes that led to large numbers of deaths in this country. And if there's an investigation, they would have to take responsibility for that. And like there is in so much of this country is the state never wants to take responsibility for their actions. Anytime there's an investigation or a tribunal, the government are pulled kicking and screaming into a situation where there is an investigation. Now, we owe the people of this country. We owe them a public investigation. We owe the people who lost their lives during COVID in the nursing homes, the ground zero of COVID, a public investigation. But we also owe the people who are losing their lives today in the excess deaths figures. We owe them a public investigation to see why that's happening. And we owe it to future generations to make sure that this will never be repeated again. And if this doesn't happen, we are going to see this crisis happen over and over again. And it's not just the government that are pushing back against this. There's practical silence from every single other opposition party in Leinster House, because most other opposition parties were actually pushing the government to do more in terms of restrictions during COVID. There was one political voice in terms of a political party, and that was Eireann. And we will call the government out over and over again in relation to their wrongdoing around COVID and their refusal to carry out an investigation to make sure that we can save lives in the future.
Rural Independent Group.
And Kate Shees, I want to thank the Concordia because I've asked for this debate in Business Committee for the last 18 months, and he's been facilitating this debate. And just to remind Deputy Tobin, we might be a political party, but we've been fighting this issue a long, long time. And I fought at every Business Committee, but thanks that we have it here today. According to data from General Registrar's Office, GRO and RIP.ie, Ireland has experienced a significant rise in excess deaths since 2021. 2021, an increase of 14.8%, translating to 4,600 excess deaths. 2022, a spike of 18.4%, amounting to 5,700 excess RIP. And so sad. One death is one too many. 2023, so far, up to September, a rise in 19.4%, 4,500 excess deaths. And in total, there have been 15,000 excess deaths since 2021 and 2023 so far. So that's alarming. And a preliminary analysis of these deaths shows that excess deaths for August 2023 in Ireland are at 21.1%. So there's something wrong here, Minister. And I'm very disappointed, Minister, nothing personal whatsoever, that the Minister for Health couldn't even bother to come in here. I've raised this here in the House more times, and the Minister, no answers. He would go to the CMO and come back. Nothing, just ignoring it. You can't hide your head in the sand and send in the General Minister for Agriculture in to deal with this. It's an insult. I know where Minister Hildegard knocked on earlier. As I said, in September, 19% above normal. So this is a shocking figure. Eurostat figures for Ireland, the EU average for the 12 months of July 2022 to 23 show that Ireland is above the EU average for every month bar one, July 2022, when our rate was 16.4%. Since January 23, Ireland is exceeding the EU average every month at ever-increasing cost. So look, we have to have an inquiry here. We know the bedlam is going on in health. We see what's happening in the A&Es. We see the cutbacks all over the place, embargoes now again on recruitment for people at home helps. Do our people not matter to you anymore? We want an international independent inquiry into these deaths, alongside an international independent inquiry into the way COVID was handled. So I'm saying that, and our group are saying strongly, we want an independent inquiry, not by the usual suspects that they come in or retired eminent justice or something. Somebody from outside the country would be fair, objective, and discreet. Thank you.
Thank you very much. In recent times, Minister, Ireland has seen a remarkable demographic shift with a 22% increase in individuals aged 65 and older between 2016 and 2022, significantly impacting mortality rates, considering that most deaths occur in older age groups. This demographic change likely contributed to a higher absolute number of deaths. Disturbingly, Ireland has recorded excess all-cause mortality for 5 consecutive weeks from late 2022 to early 2023, with substantial excess mortality due to pneumonia and influenza during that period. This phenomenon isn't unique to Ireland. Other European countries have observed similar trends. Furthermore, the data collection methods used in Ireland raise concerns with excess deaths consistently surpassing historical averages. Given this alarming situation, we firmly believe that an independent inquiry into these excess deaths is imperative. It's shocking, and it merits an investigation akin to a pandemic inquiry. The lack of specific government measures to address these excess deaths is deeply concerning. We need answers about the causes and implications of these fatalities, as well as a plan to prevent them. And I also want to mention about the serious amount and rise of strokes, hemorrhages in my own constituency, West Cork. It's astonishing the amount of young people, thanks be to God, some people are recovering from that situation more. Unfortunately, young people have lost their lives. There's no answer to it. It's a mystery to some people, not to everybody. It's a mystery as to what's going on. But during the COVID-19 pandemic, many illnesses went untreated, further straining our healthcare system. We must improve data collection and analysis to better understand these issues. Waiting times for medical services have grown, impacting the well-being of citizens and potentially contributing to excess mortality. As our healthcare system grapples with these complex challenges, we must take immediate action. We need an independent inquiry into the excess deaths, better data collection practices and comprehensive plan to address pressing concerns in our public healthcare system.
I'm glad to get the opportunity. And yes, of course, we have had a massive, and still have a massive amount of people dying in the county of Kerry. And I suppose, first of all, I want to say the worst thing that ever happened in our country was the amount of elderly people and people who died alone inside in hospitals and nursing homes and their family members, despite all what they did in their lives for community and for family. They died on their own, and that can never again be allowed to happen, Minister. There's a lot of conversation, and the word vaccination, the minute I'll mention that I'm accused of being anti-vax. But the conversation is out there, Minister, and people are asking, why are all these deaths happening? They're saying, is it the result of COVID? They're asking, is it as a result of the vaccinations? And they need answers, and we need to have an independent investigation into what's happening at the present time, because life is precious, and we want people to live as long as possible. We want the babies that are being aborted, we wanted them to live, and still do. But the increase in deaths all over needs to be investigated. Clots, heart attacks, strokes. Why are doctors and nurses reticent? They'll tell you privately, but they won't. It's like as if they're silenced. They won't come out and tell exactly what they think are the causes, because they know they've been dealing with the patients who've died. People in their 40s, young people who should be around for many years to come, and there is concern as to what's happening in our community. Minister, please adhere to the request for an independent investigation into what has happened. And just one other thing, Minister. The Chinese have got away scot-free with and no accountability derived from them as to how the virus started and how we paid such a high price for it.
Thanks very much,
You're down for sharing.
Sorry?
You're down for sharing with your colleague.
Oh, I'm very happy to share with my colleague or any number of colleagues that wish to have time, because I simply don't really haven't formulated my thoughts on this. I mean, clearly there are, or it seems quite clear to me anyway, that there's been an increase in excess mortality, but I've no idea why. Obviously various reasons are posited, some conspiracy theories, some not. I don't know, but I suppose what I find most perplexing, I don't know what the reason for that is. I would join Deputy Murphy, and I wouldn't often maybe join him, or he might wish me to join him in anything, but I would join him in saying that I have an open mind about the matter. I think we do need to find out what is behind the reason in excess deaths. But I suppose I'd just make a couple of observations. I mean, clearly there seems to be a worrying trend. I mean, obviously, diagnoses of various cancers in particular were delayed as a result of COVID-19. Whether that was inevitable probably was, with the benefit of hindsight. I mean, hospitals were simply overcome by the treating people with COVID-19. But I suppose the one thing that I took from it was that, like, deaths almost became, there was almost a hierarchy, and deaths from COVID-19 became almost a more serious matter than deaths from anything else, and that was a major worry of mine. That's not in any way to take from the pain and suffering of families who lost people who had COVID-19. But, you know, I remember my own mother was in a nursing home and thankfully died before COVID-19 arrived. And it was the April of 2019. And she was quite ill. She had a flu. There was a flu doing the rounds. And a number of her fellow patients died at that time. And a nurse said, you know, it's really sweeping them. And it's taken X, I remember the figure, but I mean, it's taken a relatively large proportion of the long-term patients. And of course, she was very sad about it, very compassionate. I mean, the standard of nursing was excellent from this nurse and from all of the nurses in Eireann Community Hospital, indeed, all of the staff there. But I was struck during COVID-19 about, you know, how accepting we were that people die. And it is an inevitability that we die, and particularly at a certain age that people die. Compared then to, if the same number of patients had died in Eireann Community Hospital in April 2020 as had died from influenza in 2019, there would have been an RTE van outside it, and it would have been the subject of discussions in this House. And that struck me as somewhat strange. And I do think that we became incredibly focused on COVID-19 to the exclusion of everything else, and that, I think, was problematic. The other thing was how it became very apparent to me that, you know, everybody was saying, well, we need to follow the science. And of course, science isn't, unfortunately, very clear, particularly cutting-edge science at any given time, what it indicates, what it doesn't. I mean, it is now abundantly clear, you know, that the Earth orbits the Sun. But that's several hundred years after people nearly lost their lives for suggesting that, and you know, it wasn't clear at the time. It is now, but there's a lot of things that aren't clear now. And what I suppose I find a bit concerning is the ideological, how much ideology influences scientific belief. And it does. I mean, I think it is wrong to suggest that scientists, no more than anybody else, can just park all of their views when they're arriving at a determination on something, because I don't believe anybody can, and I think we need to be aware of that as in this House. I think it's something that we need to be more aware of, perhaps as a society, that everybody brings their baggage with them, and that baggage is going to inform how they view the world, it's going to inform how they do their jobs, and it's going to inform all of the decisions that they make, because I don't think that you can park your ideology, park your philosophy, part of what has driven you to be a scientist, to give your life to this, and suddenly sort of say that there is an objective right answer and a wrong answer. I'm not convinced that that is the case. I am convinced, though, that there's an increasing, people are increasingly adamant about the correctness of their own views, and that their own views are not in any way influenced by anything other than the truth. And I suppose, like, social media, when it first arrived, was going to provide this sort of town hall forum for respectful debate, and that everybody could have the respectful debates, not just with their neighbours and their friends, but with people all over the world. And instead of that, it's led to people becoming incredibly trenchant in their own views because they find them echoed. If they're echoed once anywhere else in the world, well, sometimes that's enough for people to feel affirmed in their views, and they become increasingly trenchant. This discussion of excess mortality in social media is just one example of that. I think it was right through COVID on both sides, and I mean, there's a concern being expressed by many of conspiracy theorists on one side. I mean, there was plenty of abuse going around from all sides and from people with all sorts of viewpoints on how we as a society should respond to COVID. So I think I've taken up enough time to say that I really have no idea what's causing this excess mortality, but we do need to investigate what's causing it, and we do need to realise that those who investigate it probably don't have a monopoly on accuracy either. Thank you.
First of all, I'd like to thank all the deputies who contributed to this very important debate here this afternoon. And it is important to note that peaks of mortality are not unusual in winter, most commonly as a result of factors such as cold snaps and the increased circulation of respiratory viruses, in particular viruses with epidemic and pandemic potential, such as COVID-19 and the flu. The Health Protection and Surveillance Centre, or the HPSC, reported significant excess all-cause mortality in Ireland during the first COVID-19 pandemic wave, and again in January-February 2021 during the third pandemic wave. Those aged 75 years and older were most affected. During these two periods, excess mortality reached the highest levels ever recorded in Ireland since data became available back in 2009. The HPSC also observed a period of significant excess mortality during December 22 and January 23 over 5 consecutive weeks. Influenza activity was at very high levels in Ireland during December 22 and January 23, with a high number of influenza hospitalisations reported. Excess all-cause mortality has been observed in previous seasons when influenza viruses circulated at high levels in Ireland and Europe, such as during the 2017 and 2018 flu season. The HPSC has extensive ongoing surveillance in place to monitor morbidity and mortality associated with COVID-19, influenza, respiratory syncytial virus, the RSV, and other respiratory viruses, and liaises closely with both the European Centre for Disease and Prevention and Control and the World Health Organization. Considerable ongoing public health measures are implemented, including COVID-19 and flu vaccination, antivirals for treatment and prophylaxis, and various non-pharmacological interventions in order to reduce associated morbidity and mortality. These measures include a programme for the administration of the COVID-19 booster vaccines and influenza vaccines for vulnerable populations and those most at risk of severe infection. COVID-19 and influenza vaccination provide the best protection for vulnerable populations and those most at risk of severe disease and death. It is widely recognised as well, Lascian Corla, that vaccines save lives. They are a simple and effective measure to help reduce our risk of becoming ill from viruses, and they also help prevent the spread of infection. The HPSC conducted a COVID-19 vaccine impact study from December 2021 to March 2023. An adapted formula from an internationally recognised and peer-reviewed methodology was used to estimate COVID-19 vaccine impact in Ireland during the Omicron period. National surveillance data on notified outcomes, national vaccine coverage data, and vaccine effectiveness estimates sourced from the World Health Organization's live systematic review of vaccine effectiveness were used to estimate impact of the vaccination programme. Between December 2021 and March 2023, the study estimated that the COVID-19 vaccination programme in Ireland prevented the following outcomes: 102,000 hospitalisations with COVID-19, 3,300 ICU admissions due to COVID-19, and 16,000 deaths due to COVID-19. The study concluded that during the Omicron period, December 21 to March 23 in Ireland, the COVID-19 vaccination programme prevented COVID-19 related illnesses, including ICU admissions and deaths due to COVID-19. Vaccination therefore protected population health and capacity in the healthcare system. The benefits of vaccination are ongoing, emphasising the importance of vaccination. The COVID-19 booster vaccine is currently available free of charge to certain groups, including those aged 50 years and older. The flu vaccine is also available for free to certain at-risk groups, including those aged 65 and over. The alignment of Ireland's COVID-19 and influenza vaccination programmes during the autumn and winter period of 2023 will serve as a critical enabler to maximise uptake of both vaccines to eligible cohorts where possible and appropriate. In conclusion, Lascian Corla, again I would like to thank all those who contributed to today's interesting discussion and very important debate. I would again reiterate that there is a significant amount of ongoing work being undertaken in relation to mortality trends within Ireland. I would like to take this opportunity to reinforce the need for timely death registration data. I outlined earlier the ongoing work that is currently being undertaken by the Department of Social Protection, the General Register Office, Department of Health, Health Service Executive and the CSO to improve the timeliness and process of debt registration in Ireland. I welcome a speedy completion of technical, procedural and legislative change required to enable more timely access to debt registration data. Thank you very much.
Sin deire le rátas maidir le tróchtaí I másbaracht agus meastachán wasbaracht bhreise. That concludes statements on trends in mortality and estimates of excess mortality. And now the Dáil is adjourned till 5:15. 5:15.